70 years young today, can we say a massive thank you to all those who over all those years have worked so hard in our National Health Service to keep us all safe from whatever part of this world or this country they've come from. They've made the effort, and thank you especially to the Windrush generation for their work as well. The NHS was a creation of an Aaron Bevan and the post-war Labour government, but the inspiration came from the mining communities in South Wales, it came from the Tredegar Health campaigns, and it came from a belief in working class communities that they deserved the very best that healthcare could provide, knowing full well that at that time they never got it. And Bevan was very clear that there should be a national health service with national standards equally provided for the whole country. And there are many people here today who've campaigned very, very hard for the National Health Service and tried to stop cuts taking place and tried to stop the destruction of our services. But can I say today, a special salute to those from Wrighton and Lee campaign stopping the privatisation of their jobs and their services. Children growing up in insecure, damp, overcrowded, private rented accommodation with only 6-month tenancies have a stress level that many others find hard to comprehend. So what I want to do is get a different government in that's committed to the National Health Service. But I also want that government to be committed to hope for young people, hope for decent jobs, hope for decent education, hope for good apprenticeships, and for everyone the certainty of having somewhere decent and secure to live for the rest of their lives. We have life expectancy differences across this country that are horrendous and huge. In Scotland, for example, the gap between the life expectancy of the best off and the worst off is 26 years. 26 years difference because of all the health inequalities that are faced. And so I say this to you. Our NHS was founded because people had vision. People in working class communities came together because they wanted each other to be healthy and they wanted to be able to employ a doctor, a nurse, a health centre, or whatever was appropriate in their own communities. The creation of the NHS was a coming together, a learning of that experience in all those communities. And we've got to do it all over again in mental health, in social care, and in ensuring our NHS remains public and there for all time.